I'm Joe Arthur, the Executive Director at Central Pennsylvania Food Bank. Even though we live in really a garden spot for the country, hunger is very prevalent in the Susquehanna Valley as it is around the country. A lot of the growth in hunger that we've seen over the last 4 or 5 years really is a result of the economy and the recession, the results of that. So unemployment and underemployment are a huge part of why we've seen such an increase. And that increase has been about 50 to 60% over the last 5 years. So some very big increases. We have a very short mission statement so we can all remember it. It's fighting hunger, improving lives, and strengthening communities. And how we go about doing that, we work with about 700 community partners throughout the whole Susquehanna Valley. And each week we serve about 46,000 people now. Probably the most important thing that we're doing right now is really ramping up the amount of fresh produce that we're bringing into our system. And if it wasn't for us providing that produce, many of our clients would not be able to obtain fresh fruits and vegetables. We're able to provide that to them free of charge. We use a concept called Foods to Encourage. So we're trying to provide more and more access and then try to help people make the right decisions, rather than be punitive. The most vulnerable populations are really the most at risk for great harm from hunger. Children under the age of 5, if they don't receive proper nutrition really each day, they can develop learning disabilities, physical disabilities, that's going to last their whole life. So under 5 years old, vital. Elderly people, it could literally be a life and death situation if they don't have enough nutritious food. And if they're faced with picking between affording their heat or utilities, their medication and proper nutrition, that's a horrible choice to make. So the vulnerable populations, it's vital that we serve them. The ability to go to a grocery store is a challenge when you don't own a car. Or the bus routes really aren't conducive to shopping and bringing your food home. And then there's physical disabilities. Many of the families that we serve have someone disabled. So these are challenges that they face every day that we kind of take for granted. The more access, the better. That's how we're trying to solve hunger. Compared to about a year ago, we're moving about 4 times as much produce. We've built a lot of infrastructure. We've helped our program partners by buying refrigerators for them and actually freezers for healthy frozen foods. And last month we distributed about 500,000 pounds of produce. That equates to about 2 pounds of produce a week for the people that we serve. A lot of this product is coming from what's called a second harvest, where it doesn't quite meet retail specifications, but it's very healthy, it's very fresh. In fact, it's equally as fresh as what you buy in the supermarket. It just might be the apples might be a little bit smaller, a little bit bigger, the potatoes a little bit bigger, that sort of thing, but perfectly healthy, good food. And we're able to capture that through our sourcing and have it not go to waste. Otherwise it would lay in the fields. And it's going to people in need. It's going to be on dinner tables this week, tonight even. So we're very proud of this. It's particularly rewarding to see the movement to better health. We're very excited about that. We're excited to be part of that movement. Each time we do a distribution, it's gone. People take it and they're using it. So rather than it going to waste in fields, it's here being used by people in need.